Well, thanks for joining us, ladies and gentlemen, for the interagency briefing. We got this thing called COVID. I know that's a news flash for everybody. And we're talking about dealing with COVID Centric as well as infectious disease control, IDC, facilities, cleaning best practices. Just a little bit of that going around, huh, Mr. Ball?
Yes, sir.
Just a little bit of that going around. Fortunately, we're actually going to start opening up, we hope. We want to welcome Al Ball III. He's the founder and CEO of Diverse Professional Solutions. And just in your honor, Mr. Ball, I got these just to honor your photo.
Yes, sir.
I couldn't resist. I'm sorry, man. That was awesome. Love it, love it, love it. We want to welcome everybody that's decided to join us. Tons and tons of different agencies. A lot of questions about opening up and what it looks like and what cleaning really looks like, and some folks wanted to learn a little bit more. I want to welcome everybody. If we missed your logo, apologies. There's some folks that came in on the backside that we missed, but bunch of people here, Al, that are interested in this. Real quick, do some introductions with you to Al and let you know about him. Talk about briefing controls and how you can participate, because that's what it's about. It's not just about talking. Presidential Memorandum M2115 is why we're here, as well as CDC Guidelines, ISSA recommendations, got some peppers in there from EPA as well. So some of your challenges we want to hear about from you, and some of the best practices for a safe work environment. And we'll get to some procurement options and additional resources. Real quick, briefing controls. If this is your first time on a virtual meeting and you've been living under a rock someplace, you can adjust this. You can make us bigger, smaller, if you want to see the briefing. We do have the session handouts, and that's probably one of the questions that's happening right this minute. Greg. All right. Greg Searle is also with Brenda. That's fantastic. You're allowed to do that. Multiple people at the same time, right? All right. So I just posted a bunch of links into the chat. Zoom does not allow us to add these things as files for your protection, but you now have the links in the chat, and I'll probably do that again for the late folks here, but we'll get that to you at least. You'll have access to all these pieces as a result of that, and we'll get started. A couple of people, we asked a question, best briefing ever. Tammy from Vision 11, I love it. It's freaking brief. Make it brief, for God's sakes. If it's a briefing, make it brief. Stephanie, she's with the State Department. CDC practices are covered. We'll cover some of those for you. Brenda, nursing supervisor. And I don't know how to say that, Brenda. I don't want to say it wrong for the Prairie Band. I can learn additional methods for our infection control. Love it, love it, love it. John from the VA, links to what is required by CDC. You now got them, John. So you actually have the best briefing ever because you got the links. From Michael from FEMA, they deliver key points, no fluff. Al Ball, no fluff. No fluff, says Michael.
Yes, sir.
Robin, HR specialist with the VA. We get a day of admin leave for attending. Bunch of comedians from the VA here today. Love it. Eugenia, contract specialist from Space Force. That's fantastic. And I'm going to ignore that, and I'm going to put that on do not disturb. My apologies, guys. Oh, Eugenia, learn something new. The bar is so high for you because I know Eugenia is Mensa level, so she knows a lot. So you gotta teach Eugenia something new. Just anything new will be fine. So Brenda also is, please address how and what green items are used to clean and disinfect medical facilities and Joint Commission. I love that. That's a great question. If we don't answer that directly, we'll make sure that you get follow up on that. John was talking about hopefully covers both CDC and GSA public building requirements. Love it. Under FMR. Love it, love it, love it. We're more concentrating on CDC, although we'll talk about some very basic functionalities. It's funny when you think about being clean. We'll talk some of those. All right. So Robin, is teleworking going to be preferred method or remain available for employees? That's a great question. That's more of a policy question. We're probably not going to address that too much today, Robin, but there's some additional briefings coming up that you might be interested in. IHS, verifying vendor qualifications. I love that one because hey, we all have trouble with vendors from time to time. Linda, how soon can we get back to field work? Boy, wouldn't that be nice for everybody to be able to get back to field work. Participation just like that is easy. You can chat, you can raise your hand, you can do Q&A back and forth, and I'll do my best to be able to include you. If you have something that you want to take offline, send it to GovSupport at 1DPS LLC. It'll be down in the bottom the whole time. You can check it out if you want to do that. So with that, a real quick disclaimer, because this is not affiliated or endorsed by any agency. This comes from GSA directly, by the way, and provides you, the audience, for informational purposes only. And your participation, so you can talk, is not an engagement to buy from anybody, including Al Ball and DPS. You don't have to buy from Al or DPS. It's not an indication that you're going to buy from them. So that gives you permission to be able to talk. And we can also answer a few questions of why are you here today? I want to know more about COVID IDC requirements. You can answer as many as you want, by the way. I'm responsible for facilities management. I handle HR. We got a bunch of HR folks here because a lot of this is affecting you guys. I manage facilities contracts, or my boss made me come. Somebody's got to be a Weisenheimer and answer that one too. So with that, while you're filling that out, we're going to talk a little bit about Al Ball and his group. So Al Ball, tell us about you. And I know you're down in Tampa with the winners of multiple championships this year. So try to be nice to everybody else in the country.
I'm humble. How everybody doing? Yes, I'm located in Tampa, Florida, and we do facility management, mainly janitorial. And this briefing is really just to educate you on what's the difference between green cleaning and disinfecting. It's two different things. You can't do both of them at the same time. So one, you do the green cleaning is what you do to maintain a healthy facility without harmful chemicals. The disinfecting is what you use to kill the harmful pathogens. So that's the first thing we need to know. You can't do green clean and disinfect at the same time.
And we'll talk about that. Tell us about how you got started in this thing and what you got. I know you got a bunch of different certifications there.
Yes. Well, I'm a second generation janitorial. My daddy started with a janitorial company in 78 in Tampa, Florida. So I worked with him throughout the years, went to the Army for a few years, came back, did corporate America, but also stayed with the family business. So now we launched in the federal government sector. We work for Army Corps Engineers. We also work for the VA. We also we have a contract in Philadelphia with SEPTA. The bus terminal where we do go around with the bus shelters, disinfecting them and everything. So we kind of spread out all over Florida and mainly in Philadelphia.
Excellent. And you, like you mentioned, you do work with the Army as well as the Army Reserve. That's fantastic. I'm going to go back to this slide because you happen to be certified by Green Clean as well as the Academy of Cleaning Excellence as well as ISSA. What does ISSA stand for?
It's the International Sanitary Supply Association. So they are the leader in the cleaning field. They have a lot of the shows out in Vegas, well, all over the world. Yeah. So they really write the guidelines for how we should clean almost. Okay. That's what the industry standard is based upon.
Fantastic. And I know that gets flowed down through the different organizations, including the federal government. Yes. But you're 8A, you're a veteran owned. Thank you for your service, my man. What part of the service were you in?
Army. Fort Bragg.
Appreciate that. Thank you so much. As you mentioned, you have worked with the Army as well as Reserve, so we appreciate that. We're going to get into the meat and potatoes here today, which is driven down from the new presidential memorandum, M2115. You have the link in there. And if you don't have it, let me know, and I'll make sure you're not seeing the links in chat. Oh, thank you very much. That is an ID10T error. Does everybody know what an ID10T error is? You're going to love this. Everybody's going to use this after this, right? You know, so somebody's got their hand raised. I love it. So ID10T, here it is, right? So you need to write this down. Get a pen, and you write down you say ID. So you write down ID, right? The number 10, right? And the letter T. So that is an ID10T error. So I am that guy. So I think they're there. They're great. They're there now. So there you go. I had it only for the panelists. The panelists didn't need it. Okay. So you got the links. Thank you very much for letting me know. And Janice, you as well for letting me know that. So real quick, there's a couple of links that are all in that link thing now because Janice told me. Nobody else is paying attention enough, apparently. And it talks about the policy to help to halt the spread of coronavirus. You can download that. It's great documentation. Really, there's a lot of common sense in there, but we all know the common sense is not always common. So, but that's what's there. And that's what this is all in support of, to be able to, the presidential memorandum driving that down to us. Also, we have the CDC guideline link where you can check out the cleaning, disinfection, and ventilation, all of those things. Very important, right, Mr. Ball?
Yes, sir.
Yes, sir. That's right. And being able to identify, there's some specific details there. EPA, that's EPA, not a, oh man, EPA recommendations, not FDA recommendations. EPA recommendations on disinfectant use, and you can find that there with those, as well as recommendations on specific disinfectants, which we will be talking about, right, Mr. Ball?
Yes, sir.
Yeah, yes, we will. And you mentioned this before, and this is the International something.
International Sanitary Supply Association.
International Sanitary Supply Association. There's an association for everything, right? So there you have it. And these folks have a lot of input and insight for the types of products to be able to use. So now, some of the challenges that you have out there, I'm going to open this up for you guys to tell me what the challenges are that you guys see with facilities maintenance. And there's a lot of things that are happening today. You have the changing working environment, right? You can choose as many as you want for this, I believe, right? Multiple choice. So we also have some problems because buildings have been sitting for a while. They're not meant to sit for this long, right, Al?
Correct.
And so employee concerns, there's a lot of folks that have issues with that. We have a lot of folks from HR here, which this is all dovetailing together, right? So you used to be, you weren't really thinking about building safety when you went to work, but now it's top of mind. So there's a whole bunch of things, new norm for cleaning, measuring progress of cleanliness. We'll talk about that too. And finding qualified vendors. I don't remember who that was that said that earlier. I don't have that in front of me at the moment, but I do appreciate that comment. So with that, we'll let that go. And so these are some of the problems that we have. And COVID risk management, I didn't put that up there because everybody's got COVID risk management problems, right? And but measuring progress. So we really appreciate it. And we'll once everybody, is everybody done voting for those? Voting is painless, by the way. It's easy. So we'll go ahead and end that since it's there. So you can take a look. So here's the challenges, Mr. Ball: changing work environment, employee concerns, social distancing, and the new norm for cleaning. So let's get into the nuts and bolts of exactly what that means, because we're talking about cleaning, sanitizing, true disinfection, and the impact on air quality. Is that right?
Correct.
All right. So tell us, you mentioned this as you started, is that cleaning is one thing. Tell us how the cleaning works. You're doing this every day. So tell us, from the professional standpoint, you have products that you use. What do you do? And what is cleaning? We'll talk about sanitization and disinfection in a minute, but tell us about cleaning.
Yes. Well, for the old cleaning, it was green clean. So it's a methodology. And what that means, you didn't use harsh chemicals. Back in the old days, we used to use Clorox, bleach to clean with everything, Pine Sol. So what it did, it affected the indoor air quality. A lot of people with allergies and smell control. So Pine Sol is strong, bleach is strong. So what it did, the EPA regulated safe chemicals, but then that's where you got your green clean from. So that's where we were going before the pandemic. Now with the pandemic, you have to do green cleaning, but you also have to do disinfecting. And disinfecting comes at the end. So you must clean, which is the removal of dirt, gunk, whatever you want to call it. So you have to clean first, and then you have to disinfect. What happens is everybody thinks disinfecting is spraying and wiping. That's sanitizing. So if you're using a disinfectant and you spraying and you wiping, you're sanitizing. You're not disinfecting.
Okay.
So when you're disinfecting, it has a dwell time. Each disinfectant, each manufacturer, it tells you the dwell time. Some might be 5 minutes, some might be 15 minutes, some might be 20 minutes. So, if you're not letting that dwell time, that proper dwell time, then you're not doing a proper disinfectant.
So dwell time means how long the disinfectant or whatever is it disinfectant
has to sit on the surface. Correct. How long the disinfectant has to sit on the surface.
And can you use the same chemicals for that, or is it separate? Is it different chemicals?
It's separate. The disinfectant is separate. And one thing you have to do is make sure you don't go and want to buy. A lot of people get confused and want to buy the stronger disinfectant. That's not what you want. So you have to really know that's why the ISSA and the Green Clean and the Academy of Excellence, that's what they are for. So they can teach your janitors on what's the proper chemical. You don't want to go and get the strongest hospital disinfectant to clean a regular office building.
Because and the reason being, what are they saying?
Because some of them have harsh chemicals, corrosion and everything in them. So, especially if you have a disinfectant that's used for blood or blood pathogens. So you have to be careful on which disinfectant you use. You only really need to use a mild disinfectant.
Okay, that's great to know. That is great to know. So we go back here. We have the cleaning, then we have the sanitizing, and then true disinfection. Because this is where we see a whole lot of new. This is the new norm, right?
Correct.
So how does this? And you mentioned dwell time as well. This applies here too. So we're seeing the electromagnetic sprayer. What does that mean? What is an electromagnetic sprayer?
Well, what it does, what the coronavirus is, it's a pathogen, but it has an envelope that's protecting it, almost like a force field. So you have to penetrate the force field first.
Okay.
And then so that way you can get to the pathogen to kill it. So that's what I'm saying, you spray and wipe. If you spray from the left and right and wipe to the right, all you did was take the dirt or the pathogen from the left to the right. You didn't kill it or remove it.
Okay.
So, and that's, if you see, I see a lot of, even in your gyms, you see a lot of people spraying and wiping. They're really just sanitizing, which is still safe because sanitizing getting about 90%, but it doesn't really kill. So sanitation is mostly used in food service, but it does remove, the harmful pathogen. It just doesn't do it as the disinfectant does.
And we've seen a lot of the foggers. I know with our church, you're walking around with foggers. You're seeing that, and what are we looking at here? There's a product here that is 62. What does that mean?
Well, that's just a number, but the product's from ISSA, and what it is, it's a hospital grade disinfectant, and you can put that into your spray or your fogger, and it disinfects. I want to say on that one, I think the dwell time is about 10 minutes, if I'm not mistaken.
And the dwell time, so with foggers, that's kind of getting in the nooks and crannies of things too, right?
Correct, and it also puts out electromagnetic. So what it do, it just zap. So it zaps the envelope so that the chemical can get inside to get to the pathogen.
So because it's electromagnetic, it zaps it and then it can kill it. I'm glad you're here, man, because I don't understand any of that. All the chemical things, I don't get that. That is fantastic. So being able to, now there's multiple types of distribution for these. There's a couple of different products that we see here. Who supplies these types of products?
Well, your local janitor closet should, and right now you have everybody on the bandwagon, so you can get it from Home Depot, Lowe's. So it's but to get a true electromagnetic sprayer or fogger, I would go to your local janitorial supply closet.
Okay, there you go, and that's good. And there happens to be just a couple of janitorial supply closet people on GSA and other places too, right?
Correct.
So and using now, this is a new. Autonomous is not new, all that new, right? You had the Roomba. I mean, for us homebodies now, that we're all homebodies, we got Roombas and things like that. But now you have the ability to augment this with not just doing vacuums and mops, which there's automatic, an autonomous technology for that, but also for the sprayers and the foggers, which does that lend itself to be a little bit safer than being around spraying that all the time?
Well, you still gonna need a human body, so you still gonna need your cleaning crew. And what the Wiz does, it allows them to do the big areas, the vacuuming or the mopping, where they don't have to focus on that, where they can focus mainly on the high touch areas.
Okay.
You know, where people touch doorknobs, computers, chairs, so that way you can do a proper clean, sanitize, and disinfect.
And when you talk about the doorknobs and all those, how often do you do that? Because people are touching that all the time.
Yeah, well, being that you have a frequency with your cleaning, I mean, you would do it every time you go, every time your cleaning crew comes in to clean.
And between there, does it make any sense to have that kind of have a spray to spray stuff down that's high touch areas? Any advice for that?
You got you got your hand sanitizer. So as long as you're doing your hand sanitizing and washing your hands good, you should be okay. So it shouldn't be that harmful.
All right. So that's what the CDC says too, by the way.
Yes.
You're not the only one.
Yes.
Masks, hand sanitizer, wash your hands.
Yes.
Have we heard, if anybody's missed that message, just wondering. All right. So then talk about how we can measure things when it's clean. And this black light stuff freaks me out. I'm just telling you, I really don't want to know. But how do you go and do this and you check to make sure things are clean? And this is how you do it?
So what my management team, especially in the restrooms, we use the ultraviolet lights. And what we have a marker. So, they might come in and before the cleaning crew come and they might mark an X. I mean, they might write a word. You really can't see it. But we can come back afterwards with the ultraviolet light to see if they really cleaned it.
Management by marker and ultraviolet light. That's a new one on me.
Yeah.
Well, that's
something like undercover boss. Just to make sure that everybody's doing it. Then we have your ATP measurements. When you clean the surface, and it's time consuming, but when you clean the surface, you measure it by you got a swab. You rub the swab on the surface and you put it in the meter, and it lets you know you do it before you clean, and then you do it after you clean. So it lets you know the level of cleanliness that you have done.
And that's what the little handheld thing is?
ATP meter. It's called ATP meter. Yes, sir.
ATP. And so then the other part that with the autonomous, you can also get a report of what areas were actually cleaned and vacuumed and mopped. Is that how that works with the roofs?
Right. Your program, right. The area that you program into the Wiz, it lets you know exactly what it does.
And that's what you use is the Wiz. How do you spell that?
WHIZ.
WHIZ.
Soft robotics. Yes, sir.
It's not the Michael Jackson.
No, not the Wiz. No, you can't win. No.
All right. Very, very cool. All right. So, and I got a next poll is when do you anticipate? We're going to get to your questions in just a minute. Oh, I got to stop sharing the poll results. It would have been beneficial to stop that. Then we got the new one. All right. So we're going to launch this. A lot of folks already answered this question, but let's ask it again anyway. When do you expect a facilities cleaning requirement? And it could be immediately. Can you believe we're in Q3? We're actually in Q3 of fiscal year 2021. It just blows my mind every time I look at that. All right, so we'll keep that open for just a minute. Let's see what we got. Participation is easy. Remember, easy. All right, we got some in here. Let's see. Are you going to discuss air quality in offices? The air quality in our office is horrible, and the temperature runs between 77 and 83 degrees. Joseph, you do have yourself a problem with that. Yeah. That's more than just a cleaning problem.
Correct. That's the HVAC. Yeah. So
I think you
need to talk to his HVAC.
Yeah, you need to talk to your facilities management people.
Yes.
And you probably may need to get to a commissioning agent or somebody that can come in and do some reworks. And Department of Energy, plugging Department of Energy contracts, ESPC contracts, and energy savings and performance contracts can help with that. And you can see if you're between 77 and 83 degrees, a lot of things are bad about that. But I appreciate that, Joseph. I don't have an answer for you with that. I don't think we can answer that one. All right. So we are not allowed to open windows and doors. You can't go in and can't go out. Okay. Are there any surfaces that the sprayer fogger should not touch? Scientific surfaces we should concentrate on. Great question. Who is that? Is that Stephanie? Stephanie asking great question. Stephanie Reed Smith. So are there any surfaces that you should protect and not use a fogger with? Have you seen anything like that? Or we can get information back to people if you don't know.
Well, on the fogger, it shouldn't be a problem because it's just like air. It's fogger where you can see it, the chemical. So, and on the sprayer, I wouldn't go in your IT room. And if I did, I would just make sure, because it does just a fine mist. It's almost a fine, it dries in literally minutes. It doesn't take long. If you have the right machine. Now, if you have the right electromagnetic static, you can't get these fly-by-nights. There's a lot of fly-by-nights. You can go to Home Depot, everybody trying to sell them. A lot of those don't put out what they call microns. So on your electromagnetic static, you want to make sure that you have the smallest micron, and that's the droplet that comes out.
So, right, in the size of the droplets.
Right, is the micron, yes.
So one of the things I do want to answer that question. I think we should put that out as part of the follow-up that happens when we get the recap out. I think that's a really great question. I'm gonna dive into that a little bit further and get some additional research for you, Stephanie. That is a great question. All right, who else got a question? We did have a question. Let's see. We got all the stuff, the presentations that are there. Let's see. And a lot of people ask the question about the presentation. It is there in the link. Let me know if you can't see the links, because if you came in a little bit late, I may have to repaste those to you. But let me know if you don't see those. Let's see. Got another one here. Got it. Stephanie, you're awesome too. All right, let's see. We got any other, no Q&As, nothing there. I think we're doing okay for that. Let's see. As far as, I don't see any of the emails either. If somebody kicked an email, raise your hand or we can chat another. Whoa, wowzers, that went crazy. All right, so we'll go ahead and get into just a recap of some of the best ways to stay safe. A lot of CDC, EPA, and ISSA recommendations. All the links are there. You can take a look at those. We're going to do a little bit more research for you, Stephanie, because you're awesome. And the one piece that we've been hearing a lot from HR people, especially, is there's a lot of concern, right? Everybody's got different variations, right? We know that there's some people that they sleep with their mask, they shower with their mask and all that. And so you have one side of the spectrum, and the other people that don't even know what COVID is. They don't even think it's real, right? So all those people are within our spectrum of employees and the people that we engage with. But being able to listen to people and do your best, in spite of how radical they may be on one side or the other. We are in radical times, believe it or not. But yeah, just engaging with the employees to get an understanding of how they feel. We've been talking with GSA's chief architect and the way that they're doing building operations, the new building operations. The workplace environment is changing, folks, and we're going to be engaging on that as well. And hiring certified vendors. Some of the certifications that you have, Al, you have ISSA. What are the other ones that you have?
Master Green Clean.
Okay. There's another one, some excellence.
The EVS, I got the Environmental Health Specialist.
Okay.
From GFI.
And all these folks, and that doesn't make you good, but it certainly tells you what good should be, right?
Correct.
Right? You still got to do it.
Yeah.
So there's a real question. What specific certification should vendors possess? And you mentioned a couple of them, ISSA.
One, GFI.
GFI.
It's a plethora of them. Anybody that's teaching about, the COVID and, the difference between green, clean, and disinfect, You know, so anybody that's, well, you have to, you know, we have to take a class for a week, you know, and then you have to pass the test. That's the master certification. And it's just for, you know, janitors know how to clean.
Yeah. And ISSA isn't the only one that's out there, but that's one of the leaders, right?
Right. That's one of the top leaders. Yes.
Okay. So, and then reviewing the vendor products and processes, if you use the guidelines that are set out by CDC as well as ISSA as an association, it's not going to do you bad. That's one of the ways that you can figure out if the vendors really know what they're doing, right, Al?
Correct.
Well, that's fantastic. Well, I do appreciate that. And any other questions? Did I miss any other ones? I think I got most of them. All right. So that's as far as that goes. And as we mentioned earlier, you're not obligated to buy from anybody. However, you can, being an 8A, that helps a little bit, doesn't it, Al?
Yes.
Right. And the fact that you're veteran owned, that means you're up at the top of the list for the VA folks. We love the fact that VA does vet first. And you're also a hub zone. So there's a couple of check boxes that you can do. Again, reach out. You can reach out to Al. He'll be glad to talk with you. How much does it cost to talk with you for a few minutes about things, Al? I know you charge a lot.
Free.
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 My favorite four-letter word, free.
Yes.
So you can reach out to Al. They're involved in the federal space, as you can see. You got your GSA pending, right? You put that in?
Yes, sir. We're going back and forth now.
What are they saying as far as when that's going to happen? Do they know?
Probably hopefully within the next month or two. So we close to it.
You're close. Awesome.
Yes, sir.
Fantastic. Well, that'll be good. And some people love GSA, and then I'll leave the rest of that statement for other people. All right. Well, we do appreciate you guys being here today. You will get a recap email. It includes a briefing presentation. You already have the link for it. You'll get the DPS capability statement that's also there. A link to the video. This is repurposed, and you can share this with your colleagues. And also, if you would like to meet with Al, or if there's anybody else that you would like us to connect you with, we'll do our best to be able to do that and get you in touch with the people that you want to meet with. And we want to thank you for being here. We got a couple last pieces here. Bernadette says, thank you. You are welcome. Kira had to drop off for another meeting, blowing us off for another meeting. That's just unacceptable, isn't it, Al?
Yes, sir.
Wrong. You're welcome, Kira. And nonetheless, so we do appreciate you guys being here. And we did what we said. It was going to be 40 minutes maximum. So we're getting you out. If there's any additional things that you need, shoot an email directly to Al Ball III. Al Ball III, 1dpsllc.com. You are welcome, Eugenia, from Space Force, right? Awesome. You're one of the first folks that showed up on GovBrief from Space Force. Fantastic. I love it. Love it. I think that's who you are, Eugenia. I think so. All right, guys, we're going to let you go. Al, thank you, sir.
Signing up. Thank you.
Appreciate your insight. We'll talk to you guys, and we'll let me know if there's anything else that we can do for you. Otherwise, we will see you next time, folks. Loving it. Eugenia is from the Space Force. Thank you. Love it. Thanks, guys.